Welcome back to OpenLine. If you're just joining us, our topic tonight is children's mental health during the pandemic. We all know that we've been impacted in many different ways, but it's definitely important to know what the young people in our lives are dealing with and how we can help them with that. And guiding us through our conversation tonight is Dr. Yasas Tanguturi from Vanderbilt University. Doctor, you mentioned to me before we started the program that this is a really interesting moment because obviously we're still going through the pandemic. This is still kind of a new, slightly unique situation, but you told me that there are some situations already that you've studied, that the industry has been able to study to help you understand kind of how to move through all this, right?
Yeah, we have, unfortunately, we have had experience with things like natural disasters, things like, Hurricane Katrina, the tsunami, things like that are good models for demonstrating what the long-term mental health effects and mental health disruption can happen with a disaster like that. And the pandemic, in some ways, is very similar to that. It is, there is loss of life and extreme kind of mental distress that a lot of kids go through that can have similar effects in the long term for sure. We do know from a lot of research over the last 20 years that exposure to what we call adverse childhood experiences, or ACEs, exposure to those, and those can fall under multiple different categories. Exposure to those in your childhood dramatically increases your risk for not just the obvious things like mental health disorders, depression, anxiety, PTSD, things like that, but also in the long term for like other social outcomes. So things like, decreased educational attainment, long-term physical disorders like cardiovascular health risks and stuff like that. So there's a lot of data over the last 20 years that we know that going through difficult things as kids can have like long-term effects.
Absolutely, and I know you're still understanding that as we move forward. You mentioned education in your most recent answer. Of course, that was a unique element of especially the early months of the pandemic, where students not only were socially isolated, but also were learning at home. What are some of your thoughts about maybe some of the impact that virtual learning may have had on students and young children?
Yeah, it's a kind of interesting thing, right? I would say overwhelmingly, for the large majority of kids, virtual learning has been pretty hard. There are some kids for whom virtual learning was actually easier compared to going to school, and we can talk a little bit about who some of those specific kids are. But like I said, overall, the large majority of kids really struggle with the virtual learning aspect, and that's because of some of those benefits of school that we don't even think about, like the socialization aspect of it, like the benefits of having structure, for many kids and families who also had all these other economic demands while having to stay at home. You don't have parents who are able to kind of provide the monitoring, provide the supervision while kids are at home. So that gets really difficult as well. The other element to that is which again, we don't have good data yet on, but I think at some point we will, is what is the effect of all that increased screen time on kids. The screen time has its own kind of negative consequences, and for almost an entire year, kids staying at home, being on the screens the whole time, what are the downstream effects of that? We still don't know.
And I would love to stay on that topic for just a minute, because I think screen time is something that every parent and grandparent is probably thinking about in some aspect of it, because that has become so much of, especially a child born recently, so much of their lives that you and I didn't necessarily have, and parents and grandparents certainly didn't have. So I'm curious, what are, because obviously screen time's not going away, what do you think are maybe some of those long-term impacts when you talk about screen time?
Yeah. I don't know about the long-term impacts because, I don't think any of us know because it's still so fresh and new, but we are seeing more and more data about how excess screen time seems to be associated with like increases in anxiety and depression. There's also risks of things like exposure to inappropriate content online, exposure to things like cyberbullying, other forms of victimization online. A lot of those kinds of stuff as well. I think in general, the recommendations around screen time are so hard for parents to follow because less than 2 hours a day is so hard, even as parents ourselves, the amount of screen time that we spend. So it would be interesting to see 10 years from now what we hear about the screen time.
Absolutely. You mentioned just a few minutes ago that there may be some part of the population that actually may be benefited a little bit from virtual learning. I'm curious what your thoughts are on that.
Yeah. I mean, there are kids. Well, to back up on that, so the other area where the pandemic and some of the quarantine and like school closures was really had a pretty negative effect was kids who have special needs. So kids who have physical disabilities, kids who have intellectual disabilities or learning disabilities. Those kids for whom school is a really important source of not just education but also like treatment, right? Like those kids get things like speech therapy, physical therapy, behavioral therapies, all of those things at school. So having schools shut down was obviously a big impact for those kids. However, within that segment of kids, there's also kids who struggle at school primarily because of things like, overstimulation, things like sensory issues that may have that are really difficult at school. Some kids with anxiety who struggle in what we think of like a social anxiety kind of domain. Those kids have kind of benefited from staying home and kind of being able to just work on their own work in their own space. In the longer term, we do want even kids like that to have the benefits of socialization that do come with school. But it's interesting that some of them do have some of those benefits.
And that's certainly interesting. And I don't want to veer off too much of the topic because I think this all falls underneath it. But I do think that that's interesting, the last point that you made about how it is still important, even if your child does go with a virtual option, because a lot of school districts are now seeing that there are some families where virtual does work better, and they're continuing to provide that option as a designated school. But like you said, obviously you don't want to completely miss out on that socialization factor. I'm curious, you mentioned a little bit earlier too that obviously the research specifically on this pandemic is still very new. Why do you think it's important to be able to have data to be able to track this and be able to kind of completely understand the impact that it's having on children?
Yeah, I think a good example about why that's important comes from, I guess, the thing we talked about earlier, like social media and screen time. Initially when social media was kind of still in its infancy, so early 2010, 2011, 2012, at that time, when I was still looking at the literature, it was still hypothetical. We were still thinking, what are the benefits of this versus what are the risks? And a lot of people talked about some of the benefits that could come from like social media, right? Like a lot of like the socialization aspect of it, the, meeting people that are similar to you, having interests, those kinds of things. And those all seemed really good. But then as the data started to come out over the last 10 years, we started to see that the overwhelming effect was actually negative, that the rates of anxiety, rates of depression, rates of self-harm, all of those only kept creeping up. And while there may still be pockets of stuff that may be good, the data kind of really helps us understand what the overall effects are and how we may need to adjust kind of like our policies, kind of our, responses to it, both as like clinicians and providers, but also as like parents. As a parent myself, I often think about like how much screen time should my little kid get, and what makes sense. And so similarly with the pandemic, I think moving forward, we're gonna have to figure out, how do we kind of respond to situations like this? What role does our own anxiety kind of play in the mental health of our kids? And some of that is going to be really influenced by the data moving forward.
Absolutely. Dr. Tanguturi has given us a lot to think about. I'm sure you have some questions. Feel free to call in or make your comment by calling 615-737. Plus, we'll have more of our conversation with him after the break.